The outbreak of Ebola virus in Uganda in September 2022 has continued to escalate, which has led to the formation of facility centers across the country. In a bid to reduce on the spread of the deadly virus, the Ministry of Health, the World Health Organization, and other partners have today commissioned a new Ebola treatment unit at Mulago National Referral Hospital. According to the Minister of Health, Dr. Jane Ruth Acheng, the new Mulago Ebola Treatment Unit is a semi-permanent center for suspected and confirmed Ebola patients. She adds that this will also be a training center for frontline health workers.
It is actually semi-permanent, so it will remain here and we'll use it as a training unit. Right now, it is open for treatment. If we get any suspect cases or we get any confirmed cases, we will treat them from here. It has provisions for laboratories, so we'll be testing from here. We'll convert it into a training unit.
Dr. Acheng says this is the 7th Ebola treatment unit created to handle possible new cases of the Ebola virus.
We have 3 Ebola treatment units in Mubende. We have a treatment unit in Kasanda. We have in Entebbe, and here in Mulago we have 2. Bringing the total bed capacity to about 356 beds now for treatment of Ebola patients.
The minister today also confirmed a new Ebola case in Kasanda district where a patient tested positive.
On the 29th, we had a macerated stillbirth that tested positive in Kasanda.
According to Jason Rizzo, the emergency coordinator at MSF or Doctors with Borders, Ebola affects individuals and different tools are required to respond to the epidemic.
We hope that, going forwards, we'll be able to end this outbreak quickly. And then for the next outbreak, ensure that we have the tools that we need to respond more effectively and efficiently. What does that mean? That could mean epidemiological research and innovation, treatments, vaccines.
Rizzo says this new Ebola treatment unit has modern technology with a 32 beds capacity for Ebola patients.
This visibility that is created, that you can have the human connection between a patient and a healthcare worker, and they're not just, you don't just see healthcare workers that are in full PPE all the time, but that you can look through plexiglass and that you can see who's treating you.
This new Ebola treatment unit is not only going to be for Ebola treatment, but for other infectious diseases as well. Currently, there are no new Ebola cases in Greater Kampala region. However, countrywide, there are 142 confirmed cases of Ebola, 56 dead, and 86 patients have been discharged from the treatment centers. Sharon Twebaze, CTV, PM Edition.